And now, on to our last class of sedative hypnotics, the barbiturates. Recall from our last sketch that the three Z's, zolpidem, zaleplon, and isopicolone, are associated with less harmful side effects, though can still cause some serious CNS effects and ataxia in elderly patients. And remember those benzodiazepines at Ben's Diner? They can lead to some pretty significant sedation, not to mention tolerance and physical dependence. The barbiturates, though, they're old school. They're some of the oldest anti-seizure drugs around, and when used as sedatives, they can cause serious CNS, cardiovascular, and pulmonary depression, not to mention their potential to cause addiction. Yeah, the clinical uses of the barbiturate agents are pretty slim, limited to sedation for critically ill patients and the occasional use as an anti-seizure agent. On the exam, you'll only have to know a few important facts about the barbiturates, mostly concerning their side effect profile. So let's get to it, shall we? Grab a seat, relax. What'll it be? The pompadour? The jelly roll? Vintage, yes, but it works for a select few. Kind of like the barbiturates, actually. Barbiturates work by binding to the GABA-A receptor. Yep, it's that same GABA-A receptor with the allosteric binding sites for alcohol, benzodiazepines, and a few of the newer sedative agents covered in the previous sketch. So take a look outside and you can see our recurring symbol for the GABA-A receptor. It's the GABA-A cab, of course, picking up another customer fresh from the barb shop. Looking good, friend! Actually, once you see it from the back, no matter though, because you know what's all the rage this year? Hats. If you squint a little bit, you'll be able to see Ben's Diner across the street as well. Just a little reminder that benzodiazepines have their own allosteric binding site at the GABA-A receptor. And while we're at it, let's bring back our recurring obnoxious inebriated dude leaning against the back of the GABA cab as usual, highlighting the allosteric binding of the GABA-A receptor by alcohol. Remember, that's GABA-A for alcohol. So barbiturate agents such as phenobarbital bind to their own special allosteric site at the GABA-A receptor, improving the effects of GABA. The GABA-A complex, remember, functions as an inotropic channel selectively permeable to chloride. Hence, the chlorider advertisement on top of the cab. When barbiturates allosterically bind, they facilitate GABA action at the receptor, thereby permitting an increased flow of chloride ions across the membrane. This causes neuronal hyperpolarization, inhibiting synaptic transmission throughout the CNS. So, we've incorporated again that CNS taxi light. And to remind you that we're causing CNS depression, here remember that fitting slogan of the chlorider. Take it easy. Here's the thing to remember though. Barbiturates work by prolonging the duration of channel opening in response to GABA, not the frequency of channel opening. At the beginning of the chapter, we highlighted how benzodiazepines enhance chloride conductance by increasing the frequency of ion channel opening. You know, because Ben's Diner is a breakfast place and so it's not going to be open past AM hours. Barbiturates, on the other hand, increase the duration of opening of the GABA-A receptor chloride channel. So, long hair? Getting some kind of expensive color treatment? You trying to recreate Johnny Depp's coif from Edward Scissorhands? No worries, my friend, because this barb shop is now open longer. Although barbiturates bind to a different site than the benzodiazepines, the net neurophysiological effects are similar. However, barbiturates usually have longer half-lives than the relatively short-acting benzodiazepines, and residual sedation or hangover effects occur frequently following hypnotic doses. So let this long tapering flag at the front of the shop represent the extended serum half-life of barbiturates. There's one important exception to that rule, though. Thiopental is an ultra-short-acting barbiturate most commonly used for induction during rapid sequence intubation. So, in the back, we've got an overzealous barber ready to make his primary incision. Shave, that is. See the straw dangling from the customer's mouth? Let it evoke an image of an intubated and anesthetized patient waiting for surgery. Also, to emphasize IV anesthesia specifically, we've placed him underneath our recurring sketchy symbol for IV administration. That climbing IV, of course. With a time to effect of less than 30 seconds, think of thiopental as thiol quick shave. It's highly lipid soluble and immediately enters the CNS to take effect. Thiopental equilibrates in the brain tissue within 1 minute after administration and causes loss of consciousness. But not only is it quick to act, its duration of action is pretty quick too, only about 5 to 10 minutes. This is not due to drug metabolism, but drug redistribution. Let me show you. It turns out that after thiopental is given IV, blood levels begin to decrease rapidly. And that's because the accumulation of thiopental in the brain is followed by its rapid redistribution into skeletal muscles and adipose tissue. Kind of like how this next customer's hair starts on his head but is immediately snipped away and redistributed onto his arms and abdomen. So remember, the rapid plasma decay of thiopental is not due to drug metabolism, but redistribution of the drug to other tissues throughout the body, especially skeletal muscle and adipose tissue. This rapid brain clearance leads to recovery from anesthesia. Take a close look at his bib and you'll see the redistribution graph similar to what you might see on the exam. That first sharp decreasing line represents the rapidly decreasing plasma levels of thiopental as the drug redistributes outside of the circulation. The curve in the center represents the drug concentration in the brain rising, equilibrating, and then immediately falling as the drug enters body tissues. And the last rising line represents redistribution as the drug rapidly accumulates in skeletal muscle and adipose. Alright, so thiopental is thiol quick shave, an IV barbiturate used for rapid induction of anesthesia. Let's focus now on another IV barbiturate, phenobarbital, that also causes clinically useful depression of CNS activity. This time, though, we're going to be suppressing seizures. See that construction worker next to the IV outside, clutching onto his jackhammer as it shakes uncontrollably? As his friend rushes over to unplug the machine, remember that this seizure-evoking hammer operator is our recurring symbol for the management of epilepsy. Phenobarbital is among the oldest anti-seizure drugs still in use. Is it effective for the treatment of generalized and focal seizures? Yep. Will it stop pretty much any seizure at high enough doses? You betcha. Can that be a really bad idea because of substantial sedation and depression of respiratory and cardiac function? And there's our problem. Despite its efficacy, phenobarbital is generally not used as a first-line anti-seizure treatment in adults, though it remains a first-line agent in neonates. It's usually reserved as a second or third-line agent because administration is slow, it causes prolonged sedation, and it may involve a higher risk of hypoventilation and hypotension than other first-line agents. Before we move on to side effects, though, I want to mention one last barbiturate used to treat seizures. Primidone, which will be represented by this customer here whose perm is done, and she can't wait to show it off to the girls at the book club. One of the active metabolites of primidone is phenobarbital, and it can likewise be used to manage partial or tonic-clonic seizures. Primidone is also a first-line therapy with the beta-blocker propranolol to treat essential tremor. And notice this barber's tremulous hand as he nervously applies his comb to the carefully crafted curls. To treat that tremor, consider primidone, but in much lower doses than those used to treat seizures. Remember, since phenobarbital is one of the active metabolites, it has similar adverse effects. And that's going to be the theme of the rest of the sketch. The clinical utility of barbiturates is limited by their significant sedating effects. Keep in mind that long tapering flag above the barbershop pole. The serum half-life of phenobarbital, for example, is 75 to more than 100 hours. And during this time, multiple doses can lead to cumulative effects, resulting in profound hypotension and respiratory depression. I mean, just take a look at the elderly lady here who's collapsed at the hairdryer. Her sweater not only highlights the potentially fatal cardiorespiratory depression caused by barbiturates, but also a potentially fatal fashion choice. But we've also made the dryer evoke an image of the brain. That's because barbiturates exert potent CNS effects and are more likely to cause coma compared to other sedative agents such as benzodiazepines. For these reasons, barbiturates should always be avoided in elderly patients. And just like we emphasized with other sedative hypnotics, these effects are exacerbated by other agents that depress CNS functions such as benzos, alcohol, and first-generation antihistamines. So take a look out that window and keep in mind those other agents activating that GABA cab. Just like with benzodiazepines, long-term use of barbiturates leads to tolerance, meaning you'll need to increase the dose of barbiturate to produce the same pharmacologic effects. So we've brought back our recurring symbol of tolerance, a banner welcoming all creeds, colors, political leanings in that age-old debate. Does Genesis do what Nintendo don't? Or is Nintendo really what Genesis isn't? But I digress. Physical dependence also develops, which means that your body adapts to chronic use of the drug. And if the drug is stopped abruptly, you'll start experiencing some withdrawal symptoms. All in all, patients are at an increased risk of developing addiction, hence those addictive curls advertised on the sign. Maybe she's born with it? Maybe it's barbiturates. Alright, last thing. See little Billy over here, filled with glee as the barber cranks up that car-themed seat? Look closely and you'll notice our recurring symbol for hepatic cytochrome P450 metabolism. The CYP450 license plate attached to a chrome bumper. Phenobarbital is a potent inducer of the cytochrome P450 system in the liver, so it can increase the metabolism of other agents eliminated by this pathway, including warfarin and statins. Alright, that about does it. Let's sum up this day at the barbershop into a few key points. Barbiturates are sedative hypnotics that exert their effect by allosterically binding the GABA-A receptor, hence the CAB-A parked outside the barbershop. This is the same GABA-A chloride channel that is activated by benzodiazepines and alcohol, but barbs bind at a separate allosteric site. Also, unlike benzos, barbs increase the duration of chloride channel opening, hence the barbershop is open for longer hours. In general, barbs have similar neurophysiological effects to benzos, but with longer half-lives, which is depicted by the long tapering flag outside. Thiopental, Thiol Quick Shave, is a fast-acting barbiturate that can be used for induction of anesthesia. Its effects wear off rapidly due to redistribution into skeletal muscle and adipose tissue. Phenobarbital is an IV barbiturate that can be used to treat various types of seizures. Just remember that shaking jackhammer being safely unplugged by the construction workers under the ivy. Primidone, with her beautiful perm, can also be used to manage seizures as well as an essential tremor. But remember that the clinical utility of barbs is limited by their potent CNS effects, even more potent than the benzos at Ben's Diner, including significant sedation, hypotension, cardiovascular collapse, and even coma. Chronic use of barbs can lead to tolerance and physical dependence, too. Avoid these drugs in the elderly and avoid combining them with other CNS depressants. Lastly, remember that barbs are potent activators of the CYP450 system of enzymes in the liver and can therefore increase metabolism of drugs like warfarin. Well, that concludes our chapter on sedative hypnotics. If you thought these drugs were relaxing, just wait till I show you what's in store a few blocks down the street. It's time to hail a cab A and head on over to the anesthetics district. Hey, cab A!